Good morning, and today we're speaking with UMHS 2019 graduate, Dr. Michael McCullagh. And Dr. McCullagh, can you tell us a little bit what you're doing right now with your family medicine residency at Yuma Regional Medical Center in Arizona, and what that experience has been like for you?
Sure, of course. First and foremost, it's a pleasure to be on here today. I always jump at the chance to be able to sort of give back to the medical student that I once was. Everybody in that same position, I know how difficult it can be, and any amount of information or being able to hear about success stories, anything like that, it goes a long way. So I'm happy to be here today.
Sure.
Yeah, I'm just finishing up my residency program here in Yuma, Arizona, which is the most southwest region of Arizona, right on the Mexican border, which in and of itself is a pretty interesting place to practice medicine. I'm in my chief year, so my last year of family medicine, and I was thankfully and graciously elected as chief to sort of be a representative for my residency program. So I'm finishing the last few months of my third year. Come June, we'll be graduating from residency, and then I'll be transitioning into a new role as an attending hospitalist here at YRMC. So I'll be staying in town, and I'll be doing that for the next foreseeable future, the next couple of years, anyways. And I'm pretty excited about that.
Okay, great.
Residency has been great. Yeah, Yuma Regional brings lots of really interesting aspects to practicing medicine, things that maybe otherwise you would never kind of get exposed to. I think I first heard about YRMC as a third-year medical student, and one thing I recommend to everybody, especially as a medical student, as a Caribbean medical student, is going to as many conferences and networking events as possible. But in my third year, I went to the national conference, the AAFP National Conference in Kansas City. And I met some of the Arizona programs, one of them being Yuma. So I kind of was first introduced to them there. A number of the faculty members and the program director had given a few of the presentations actually during that conference. And then with my interest in global health, our paths just kind of crossed on a few other occasions. As a third year, as a fourth year, I went to some of the Global Health Summit conferences throughout the country, one of them in Florida, and I bumped into the program again. They're very invested in sort of global medicine, sort of the idea of local medicine, where you can kind of practice global medicine aspects, but within our own borders as well. So they have a presence in the global health community. So I was able to bump into them again and speak with them a little bit more and learn a little bit more about the program. And it kind of just worked out. I was able to come down and rotate as a fourth year medical student here at the residency program. And I was happy to have matched into this program. Couldn't have been happier. Being family medicine, you really want to have a good experience where you can, of course, both learn, practice medicine, both in the clinic and the hospital setting, but as well, really get involved in the community. So here, I've had a few really interesting opportunities. I volunteered for the Sheriff's Department here in Yuma, where I do search and rescue with them. So we're always right along the border. We're helping those asylum sort of seeker population who are crossing the border. We're here providing care. I'm sure a lot of people have maybe heard about some of the challenges with providing healthcare in sort of a setting of migrant population coming across the border, and we're right at the heart of it here in Yuma. We see it every day. We're treating these patients. We're on the border picking them up. So really cool experience, especially if you have a passion in global health or just a passion of asylum medicine in general. It's been a great opportunity, very well-rounded training. I feel very strong coming out of this program to pretty much pursue whatever I have interests in, whether it's outpatient medicine or inpatient medicine. For me, I'm going to go more on the inpatient side, but I feel very well prepared coming out of this program.
Wow. So I didn't realize. So you really are serving these underserved communities, like these migrants and people coming over the border. That's amazing. Can you just tell me a little bit?
Most definitely.
Yeah. And how did you get interested in the hospitalist aspect? Because you are going to be continuing on to a hospitalist residency at the same hospital. Can you just fill us in a little bit about that, and maybe explain to some of our younger prospective students or current students exactly what a hospitalist does?
Sure. Yeah. So I'll kind of touch on what hospitalist medicine is. And of course, this can differ depending on whether or not you want to practice in Canada or different states.
Sure.
Sort of the hospitalist role can be a little bit different. But in general, it's a specialty within medicine that is really interested in sort of the comprehensive care of the hospitalized patient. Where as a family medicine doctor who practices outpatient is sort of that role in the outpatient setting. As a hospitalist, you kind of fulfill that role on the inpatient setting. So, we're coordinating the safe, efficient care, coordinating between specialists. We're making sure the patient's getting the services that they're requiring while in the hospital. We're kind of the point person to make sure that everything's kind of going as it should. And then we're also working with a number of other specialists within the hospital, whether it's social work or case management, or to have a really, really safe discharge plan for these patients. And coming from family medicine and kind of having an expertise in what are the community resources, I've been in these patients' houses here. I understand what the population in Yuma is like in terms of what kind of services they can access in the community, what kind of lack of services that we have here. So it kind of puts you in an interesting position where both you're treating the patients, their medical problems, but you're also setting them up really for prevention, trying to keep them out of the hospital in the future. So it's a pretty cool role that you can fulfill within the hospital system.
Okay, great. And that's amazing work, it sounds like. And finally, can you just tell us one or two things that you liked the most about UMHS, about being a UMHS student as a Canadian studying medicine abroad, and how UMHS helped you become the doctor that you are today? And anybody that on the staff that might have helped you?
Sure. Most definitely. So I heard about UMHS actually when Geneviève or Jen, some of you may know her as, she was
Right.
one of the recruiters for UMHS. She was kind of positioned to teach Canadian students about what UMHS is. And she had a presentation at my university, Carleton University in Ottawa, Ontario.
Wow.
And so that's kind of how I first learned about UMHS and what it was. And that was my first real introduction to Caribbean, the idea of Caribbean, medical schools. As a Canadian, we have a few, I tend to see a lot of Canadians at least think about medical school if they've chosen sort of a non-traditional path, in Ireland and Australia. And for me, I didn't initially really think about the Caribbean until Jen kind of gave that talk. And after thinking about it and doing research on my own, I felt like the Caribbean route was kind of the more reasonable route for me. So I knew that I probably wanted to initially stay in the U.S. and do a residency there, and doing medical school in the Caribbean affords you to have a lot of opportunity to rotate in the U.S. and kind of be in the health systems down here and make contacts and meet people within the U.S. medical system. So that and amongst many other things was kind of one of the reasons why I sort of thought more about the Caribbean. And UMHS was really the front runner the entire time. I did briefly look at a number of other Caribbean medical schools. And it may be cliche, and I'm sure a lot of people kind of say this, but UMHS really kind of has a family feel.
Sure.
I always felt very comfortable talking with every administrator, every staff member that I encountered through the process of applying. And I just felt very comfortable learning more and more about it as I did more research. The class sizes were a lot more reasonable at UMHS. And the success stories coming out of UMHS were also really great. I had the opportunity to meet a number of doctors who I could kind of see what the end looked like. And, that was one thing that really solidified my decision. But Jen definitely helped me through that process. I was very proud to go to UMHS. I felt like our education was very strong. I felt like it was an awesome adventure. I got to travel around the US. I got to spend a lot of time in different areas of the US, and being a Canadian, I think that's something that we, if you enjoy traveling, that's something that you look forward to. So I got exposed to pretty much every region of the US, from Maine down Florida, Georgia. in Arizona, Wyoming, all over the place. So very, very cool opportunity, very cool experience. As a resident here in the US, I've also worked with a number of medical students. A lot of Arizona medical students have come through, but also a lot of international grads as well, some of them even from UMHS. And I've always felt, being on this side of things, looking at the quality of education and the type of students that I was sort of supervising and working with, that it was always the Caribbean medical students that were more interested, seemed to be more well-rounded people, seemed to be just strong people, strong candidates. I think a number of reasons for that, most likely. One of them being, coming to the Caribbean is non-traditional. A lot of the time, these students applying on this pathway have had either a first career, or who have had a lot of experience within not just the medical community or medical specialties, but just really interesting sort of experiences in their life that have made them resilient people, made them prone to getting through difficult situations and coming out positively on the other side. And I felt like I could really see that, and I could see the difference between the Caribbean students and so the US IMG, or the US medical students as well.
Okay, excellent. All right. Well, I want to thank you so much for your time today, Dr. McCullagh, and I wish you the best of luck in your residency and your upcoming hospitalist residency. Okay.
Thank you. I appreciate it.